So the quiz this week is actually not going to open until Friday morning, and then it'll be due on Sunday evening. So, and I'll touch on that again at the end of class, but if you have any questions, let me know. All right. Okay, so today we are discussing simple experiments. Okay, so we've kind of covered some non-experimental research. We've talked about simple correlational designs. We've talked about multivariate correlational designs. And some of the hallmarks of those, with those correlational designs, we can detect relations as they naturally occur. Those allow us to make predictions. Right, so it's a good starting point for us. However, there are a lot of limitations. And the main one that we keep bringing up again and again and again is that with correlational designs, we can't establish causation, right? The multivariate designs can help with the third variables, but we still can't establish temporal precedence very well, right? And we still can't be sure that one thing causes another. So this is what we're kind of focusing on today, is how do we get all three of those pieces for causality in an experimental design. So if you remember, and I know we've hammered these over and over again, but those three pieces are temporal precedence, like I mentioned. So what you think is causing the other thing comes before it. As one changes, so does the other. And so that's covariation. And then making sure that there are not other things that can explain the relationship. So ruling out third variables. So when we're approaching simple experiments, we're trying to ensure that all three of those are present. Okay. So just some basis to go off of. When we're using an experimental design, we're discussing our independent and our dependent variables, much like we do with any design. So our independent variable being the predictor, dependent variable being the outcome. But when we're doing an experiment, the independent variable has to have at least one manipulation. So that variable has to be something that the researchers are altering, changing, assigning, and somehow impacting the participants in some way that they would otherwise not be exposed to. Okay, so the manipulated variable, it could mean lots and lots and lots of different things, right? We could have manipulation of happiness, like the example on the slide, using a funny video or a sad video. We could have a treatment, so pill A versus pill B. We could have any number of things to induce some type of change in the participant. Okay, so they're being exposed to something in some manner. Okay, so how do we interrogate the construct validity of a manipulation? So if we're thinking back to a correlational design, construct validity is still really important, but we're thinking about, are we measuring what we intend to measure? So let's take self-esteem, for example. If we had a simple or even multivariate correlational design, and self-esteem was our independent variable, our predictor, and we had some questionnaire to measure self-esteem, right? We're still concerned with construct validity, but in that case, the question that we're asking is, does the self-esteem questionnaire actually measure self-esteem, right? When we're doing an experiment, we want to be questioning the construct validity of the manipulation, which is, does the manipulation actually impact what we think it's impacting, right? So is it manipulating what we intend to manipulate? And sometimes that's where manipulation checks will come in. So a manipulation check is something that you're measuring in the experiment, in addition to whatever your research question is, to try to get a better sense of, did your manipulation actually work, right? So there's a whole number of ways to do this, right? But let's say you had an experiment where you were trying to induce stress, right? A minor level of stress in a participant, right? So maybe you had them watch some video that was like really, really stressful. It was about, I don't know, studying for exams, and it just showed students that were just under so much pressure, and the manipulation is that you're trying to make the participant feel stressed out, okay? And you think that that is going to impact their performance on a math test that you give them later on. A manipulation check might be asking participants at the end of the experiment, hey, did you actually feel stressed after you watched this video? And they might say, yeah, I did, right? Or maybe they say, no, it didn't really bother me. That would be one example of a manipulation check, because you're trying to get a sense of, well, we tried to manipulate this thing, but do you as the participant feel that actually happened, right? So those are important too, to get a better sense of if your design is working or not. And there are flaws in that too, right? Participants might say, oh yeah, it worked. Yeah, everything was good. And they don't really mean it, all right? So there's issues with this, but it's a useful tool for sure. Okay, the dependent variable in an experiment is always what's measured. So we are never manipulating the dependent variable, right? We are only manipulating the independent variable and seeing how that affects change in the dependent variable, right? So if the IV is putting a quarter into the vending machine, the dependent variable is seeing what snack comes out of it, right? So we're not touching the dependent variable, we're just measuring it. And we suspect that it will be different depending on how the IV is manipulated. So how do we manipulate variables? All right, so there are a lot of different ways, but these cover the three general types of manipulations that we tend to do in research. So the first is a presence versus absence approach. So you may have heard of these types of designs. So just so you know, I'm using clinical language for all of these, treatment, tablet, drug, but this could apply to anything. It could apply to experimental social psychology. So it doesn't have to be clinical, right? But this is just the example I'm using. So the first approach, presence versus absence, we're talking about a real intervention versus either the lack of the intervention. So the control group doesn't take the drug, the treatment group does take the drug. It could be a placebo, where maybe they take a sugar pill, a placebo pill in the control group, but it doesn't actually do anything. That would be another example, right? Often what you'll see in clinical research is that the control group gets put on a wait list. So, some might say it's unethical to give one group a treatment and not give the other group a treatment if they're cancer patients, for example, right? So what one might do in that case is say, all right, we're going to give half of folks the actual treatment now, and the other group is going to be on the wait list. And we're still going to measure everything that we intend to measure, but then after the experiment's over, we're going to give the control group the treatment as well, right? So even then, even though they're on a wait list and they're still going to receive the treatment, we still have a control group. Another method of manipulating variables is varying the amount of the independent variable that the participant receives, right? So maybe a third of folks get half of a tablet of the drug, maybe a third get one tablet, and a third get 2 tablets, right? So we might suspect that there's a greater impact of the treatment on the dependent variable based on how much of the drug they're receiving. Okay, so that's another method, is varying the amounts, the dosages that the person's receiving. A third example would be altering the type of independent variable. So meaning we have different things that people are being exposed to. So maybe half get this one treatment and half get another treatment, right? So they're actively different. This is often what you see in clinical research, often when you're trying to compare the efficacy of two different things. So, you know, if Pfizer came out with a new COVID vaccine in like a year and a half, 2 years, and, you know, it was intending to, vaccinate against the same COVID strains that we've been dealing with all along, they might do a clinical trial eventually where they're comparing their old vaccine to their new one and seeing, are there additional benefits to the new one? So that would be kind of this third approach where you're comparing two different treatments to see maybe there's better effects from one of them than the other. Now, there are still threats to internal validity when we're doing experimental designs. That should be clear that we're always thinking about that. But random assignment is one of the single best ways to account for this. And I know we've discussed random assignment before, but this is kind of really where the rubber meets the road, because we definitely want to be using this in experimental designs. And again, just to reiterate, with this image, I like this image because it really illustrates the idea well. So this is our sample. We have however many folks in here, 1, 2, 3, 4, 5, 6, so 12 folks in here, and they're different in some meaningful way, right? So maybe the orange people are one gender, the green people are another, maybe the orange people are older adults, green are younger adults, right? But there's some meaningful difference, probably on a lot of different factors in the sample. So the idea behind random assignment is we're going to randomly take people from this sample and evenly distribute them between two groups, right? So the idea being, because it's random, we're trying to evenly distribute these differential characteristics, right? So we have a good mix of young and older adults in both groups. Maybe it's not the exact same, but if your sample size is large enough, it doesn't matter, because it all flushes out, so to speak, and evens out. Now, of course, the issue, if you have a small sample size, you only have 4 people, right? The likelihood increases that you have differences between the groups, right? Maybe there's the 2 green people come to this group, the 2 orange people come to this group, and then your random assignment has effectively done nothing to account for those things. So sample size is really important with random assignment, but it's a really excellent tool for experimental designs. Another method is what we call a matched group. And this is not random. There can be random components to it, but we're controlling for one specific factor, one specific characteristic in the sample, and we're ensuring that there's an equal level of that factor within each group, right? So usually this comes into play when we're really concerned that there's going to be group differences, or that the group differences could really impact the experiment, right? So if you imagine we had a design where we have an intervention of like tutoring, right? And, you know, in one group they get tutoring, and in the other group they don't get any tutoring, right? Or they get something else, right? And we really want to make sure that there's no differences between the groups in academic performance, right? Because if, let's say, the people in the group that received the tutoring started off with a higher average GPA, they're probably going to do a whole lot better. And it's not necessarily because of the tutoring, right? It's just because maybe they were more academically driven or even smarter to begin with. So if you're really concerned about that, a matched group design, what we would do is we would measure GPA, first of all, and then we would ensure that for every participant in one group, there was a participant in the other group that had the same level of that factor. So in group 1, we have somebody with like a 4.0 GPA. We want to make sure in group 2, there's also somebody with a 4.0 GPA. Somebody with a 3.5, 3.5, 3.0, 3.0, and so on, right? That way, every single person has a matched participant in the other group. So we're accounting for that difference. The only issue with this, right, is it's not random, right? So even if you're matching them on this one particular variable, that may introduce systematic differences on other things, right? Because you're not randomly sampling. So that is an issue. But sometimes a matched group can be helpful. So you've heard me talk about assigning folks to this group versus the other group. And I keep using this group language, right? So an important distinction we want to make in experimental designs is between group versus within group, okay? In between group designs, we have, so here are our two groups, right? Our independent variable, dependent variable. So this is one group, this is the other group. These groups have distinct participants, completely different participants. So half of our sample is here, half of our sample is here. It doesn't always have to be 50-50, right? But you get the idea that these are different individuals in these two different groups. So only half of your sample is being exposed to one level of your manipulation, and only half are being exposed to the other level, okay? That's why random assignment is super important for between group designs, to ensure that the groups are as comparable as possible on as many characteristics as possible, so that the only difference between them is the manipulation that you're using. In contrast, within group design is when you have all participants exposed to all levels of the manipulation. Okay, so I'll say that again. Within groups design is when you have all participants exposed to all levels of the manipulation. Okay, so everybody gets everything. And there's different ways that this can happen. So in a repeated measures design, often what happens is participants get exposed to one level of the manipulation, and then later on, they get exposed to another level. And maybe there's multiple levels, right? So then that keeps going on. So if we think about an example, so I'm going to use an example from some of my research. So brain stimulation, right? So if we're interested in like doing this type of non-invasive brain stimulation, and we think that's going to help for anxiety, right? And in our design, we have a real active brain stimulation, right, that we think is actually going to have an impact. But then we also have a placebo, or we call it like a sham stimulation. So it actually is doing nothing, but it looks the same, it feels the same. You still have the contraption on your head that's delivering the stimulation. So in a repeated measures design, what we might have would be participants first get exposed to the active, the real brain stimulation. And then 3 months later, they all get exposed to the sham stimulation, right? And they're not aware of this, of course, which one being which. But that way, everybody gets exposed to everything, right? So it's a powerful design because we are completely flushing out any differences that could exist between the two, or between any individuals within the design, right? It doesn't matter if they're different ages. It doesn't matter if they're different, they have different genders. It doesn't matter if they're from different racial ethnic backgrounds, because it's the same individual that's getting both pieces, okay? And of course, those things all matter, especially when we're talking about moderation effects, mediating effects. But in terms of the internal validity, it's much more powerful, okay? A concurrent measures design, on the other hand, is when participants are exposed to all levels of the manipulation at the same time. Okay? So an example of this might be, I don't know, let's picture like we have participants come into the lab, okay, some type of university lab, and we sit them down like in front of a computer. So they're sitting down looking at the computer, and they're told, all right, so you're about to see two faces on the screen. Okay, so a face on like the right side of the screen, face on the left side of the screen. All right? And the researchers have a hypothesis that whichever face the participant looks at first is going to have some impact on the dependent variable, right? So they think if they look at the face on the right first, there's some characteristics about that face that's going to make them perform differently on subsequent tasks, right? Versus if they look at the face on the left, they have this other hypothesis about how that's going to go, right? So each participant is being exposed to both conditions, to both faces at once, but then they get, they look at one of the faces before the other. And that's how the researchers are measuring which manipulation was delivered, okay? So I hope that makes sense. Repeated measure design, everybody's getting everything, but usually it's distributed over time, so they get one thing before the other. Concurrent measures design, they're getting, again, everybody's exposed to everything, but it's all at once. And there are advantages to each of these, right, which we'll discuss. Some of the concerns within group designs, so in a between groups design, we're concerned about, are there differences between these individuals, right? Are there differences between the groups? We're trying to use random assignment to ensure that there are not, but, we're really, that's a main concern. Is one group older than the other? Is one group different in some meaningful way? Within group designs have different concerns. So again, taking that example of the brain stimulation, right? So giving participants a real active brain stimulation that's supposed to reduce anxiety and giving them a sham placebo stimulation. Let's take that example and walk through each of these, okay? So an order effect is when exposure to one condition of the manipulation, one level of the manipulation before the other impacts the outcome. Okay, so an order effect is when literally the order that you're delivering these different pieces in makes a meaningful difference in the outcome just because of the order that you're giving them to folks, right? So if you were to give people in a repeated measures design, if you were to give people the active stimulation first, right? And if you found out that you gave people the active stimulation first, they were way less likely to return for the sham stimulation later on, or vice versa. If you gave them the sham stimulation first and you know that they were way more likely to actually come back for the active stimulation for whatever reason, that would be an order effect. And that can have a huge impact on the results, right? A practice effect is when you get used to whatever the manipulation is, and that impacts the second time that you're exposed to it or to a different level of it, right? So with that same example, a practice effect might be people come in for the real active stimulation, and at first they're like, what the heck are they putting on my head? Like, this is a little strange. I'm a little bit nervous about this, a little bit anxious about how it's going to feel, right? But then, the experiment's over. 3 weeks later, they come back in to get the sham stimulation. And then they're like, oh, I already did this before. Like, I'm used to it. I'm not nervous or anxious this time because I'm used to the equipment, right? And I'm used to it being put on my head, and it's okay, right? If we're measuring anxiety, that has a huge impact, right? If our dependent variable is anxiety, and just the fact that people are getting used to the equipment reduces the anxiety, that's a huge issue, right? That can have a huge impact on our outcome. So that would be a practice effect, Okay? A carryover effect is when the effects of one level of the manipulation linger when that person is exposed to the other level. Okay, so imagine if we again give the active, the real stimulation first, and then they come back in 3 weeks later for the sham, but they're still benefiting from the first exposure, right? Their anxiety is still reduced 3 weeks later from the first time they were exposed. So then the sham looks like, wow, the sham actually reduces anxiety too, but in fact, it's really the effects from the first exposure that are still hanging around, right? So that would be an example of a carryover effect. The main solution, or the main way that we can try to control for all of these different effects in the within group design is by doing what we call counterbalancing. Okay? So this is an example of counterbalancing. So in this situation, we have the two levels of the manipulation: tasting chocolate when you're alone and then rating it, versus tasting chocolate when there's somebody else in the room and then rating it. Okay? So in a counterbalancing design, we would still use random assignment. So we would split up our group, but note that this is still within subjects, because everybody's still getting exposed to everything, but the order that they're exposed to things are different. But this is still within subjects design, right? Because the main characteristic of a within subjects design is everybody gets exposed to everything, right? So we're randomly assigning half of our sample to taste the chocolate alone first, and half to taste the chocolate with somebody else in the room, right? So the rationale behind using counterbalancing is, like, let's say we're in the room, right, with the other person, and that person, you know, the Confederate's like, wow, this chocolate is like fantastic. It's the best thing I've ever tasted. It's incredible, right? Like it's so good. You're probably going to be influenced by that a little bit. You're probably going to think, wow, I guess it is really good, right? That is really good chocolate. Or you're probably thinking, you know, this person's like batshit crazy, and I'm going to actually try to, you know, respond differently, right? So whatever the effects are, they might linger, right? There might be carryover effects, there might be order effects. So the next time that you taste the chocolate and you're alone, you might enjoy it more, right? You might say, wow, yeah, now that I'm tasting it again, that person was right. It really does taste good, right? So this is, maybe you have higher ratings here than if you were to taste it alone at first. But since we've counterbalanced, the differences between those effects get flushed out, because we have another half of people that are getting this first and then eating chocolate with the other person in the room, right? So whatever effects came from having the other person there first get flushed out, because the other half of the group is getting a different order of the exposure. Okay, so counterbalancing is really, really important when we're doing a within subjects design, especially in a repeated measures design, to ensure that there are no carryover effects, order effects, or any other type of effects that could potentially be impacting your results. Okay. So we always like to go through these pieces when we're looking at each of these different types of designs. You guys probably noticed that at the end of each type of design, we talk about, all right, what are the types of validity that we're interrogating? What are some things that we need to be thinking about when we're using these designs? So construct validity for an experiment, right? Is the manipulation working? So some of the questions we might be asking are, is the manipulation face valid? Right? If we think back to face validity, we were discussing that in the context of a questionnaire, right? Whether a questionnaire is very upfront about what it's asking for, right? And this is especially important if there's a social desirability characteristic, right? So if we're asking people, hey, do you have negative attitudes towards people that are overweight? Right? People are probably going to be hesitant to really answer that truthfully. Right? The face validity there is a downside. The same can be true for manipulation. So if we're delivering some manipulation and it's really obvious what we're trying to change, right? So if we're trying to change people's political views, and we have them watch like a 30-minute video, breaking down an argument from one political side about why the other side is wrong, it might be really obvious what we're trying to do, right? If we're trying to impact political opinion. So that's something really important to be thinking about. With external validity, we're asking the same question that we always ask. Does it generalize to other conditions? Right? So does our manipulation generalize? This is a huge issue, right? If we're testing something in the lab versus in the real world, what comes to mind for me is in psychotherapy research. Oftentimes when we're doing even the most robust clinical trials of psychotherapy research, often the people that are delivering the therapy, the therapists in the trial, are really, really well trained. They're professional. They've been doing it for 30 years. Often they're the ones that actually designed the type of therapy that they're testing, right? So the people that actually came up with it. So they have this hugely in-depth knowledge of what they're doing. So it's like a question of how much does that generalize to your average Joe counselor in a rural area doing that type of therapy with somebody? And there are questions around that, right? If you have somebody who designed the freaking thing in the first place, they're probably going to be a lot more, adherent to the treatment protocol. They're going to be a lot more invested in it as well, compared to somebody who has a huge caseload, who doesn't have a whole lot of time or energy to dedicate to learning all these different skills. Right? So that's a huge consideration. We're also thinking about internal validity. Even though experimental designs have some of the highest and strongest internal validity, we still want to be thinking about confounds, right? Order effects, practice effects. We still want to be thinking about the control group. Is it really a control group, right? If we have people that are receiving one treatment, one pill, and maybe the control group's not taking that pill, but they're taking another medication prescribed by their doctor that does a similar thing, is that really a control group? Right? I don't know. Maybe it is, maybe it isn't. But that's something that we have to think about is, are we controlling in a good way? We're also thinking about counterbalancing or random assignment. Have we used those techniques? And if we haven't, what's the reason for it? All things to think about with experimental designs. So any questions about anything that we cover, anything that's not clear to any of you guys? Okay. As always, let me know if you do have questions, thoughts, concerns. In terms of some of the reminders for this week, like I mentioned at the beginning of class, quiz 7 is a little delayed because I'm still working on grading the method sections and getting the data sets ready to send to you all. And so because of that, we're going to have that quiz open up Friday morning and then be due on Sunday at midnight. So you have a good 3 full days to take care of that. I'll send you a reminder when I open it up too, so that you don't forget with the password and all of that. We're also going to be delaying our subsequent project development assignments. Okay. And again, I mentioned this in an announcement, but it's just because I want to make sure that you have enough time after receiving your data sets to run your analyses and to problem solve, to ask me questions if you're having issues with SPSS, all that stuff. So we're delaying the results in the discussion section by a week. Okay, we're not delaying anything else. We're not delaying when the final paper is due. We're not delaying any of the other assignments, just the results in the discussion sections by a week. So the results were due this coming Monday, right? But obviously you don't have your data sets yet, so you can't do anything. So we're going to delay that till next Monday, which is the 8th. Discussion section the week after that. Okay. So I will change those in Blackboard, and just be on the lookout for emails from me for your data sets to start doing those analyses. Again, just want to reiterate, if you haven't already checked if you can use SPSS on your laptop, if you can access it through the remote, everybody should be able to, through the remote desktop. I have those instructions posted on Blackboard. There are also computer labs on campus to use, but I just want to kind of say up front, I'll try to work with you, problem solve if there are issues with SPSS. But if for some reason, you're not able to use it on your personal computer, that's not going to be a sufficient reason to not be turning in the results section. So try to do it ahead of time so that if there are issues, we can come up with some alternative, whether that means getting you on campus, whether that means coming up with a different solution. Let me know ahead of time if that's the case. Because if you're letting me know like the morning after it was due and you're like, hey, like I could never run my analyses, so I didn't turn in my results section, it's kind of like, well, why didn't you tell me a week ago? So just let me know that stuff up ahead of time, and I'll work with you to resolve any issues. But like I said, all the other assignments are pretty on point in terms of the dates and the syllabus. Okay. So if there's any questions, thoughts, concerns, send me an email. This coming Monday, again, we're not going to have class, so you hopefully will have your data sets by then, so you have a full week. I'm hoping that that's the case, so feel free to use that class period to work on those things. I would also recommend using these days when we don't have class to be updating your introduction and methods section after I send you back feedback. To prep for the final paper. That way you're not stuck at the end of the semester with all of your other classes and exams and having to worry about integrating the feedback. Hopefully having done that ahead of time will take some of that off your plate. Also, if you have questions about the feedback, good to kind of work those out with me ahead of time, so you're not pressed at the end. Okay. If there's anything you guys want to talk to me about, I'll hang around for a few minutes here, but otherwise, hope you have a good weekend, and I will see you all in class next Wednesday.